Does heartbreak cause death? Hi everyone, my name is Dr. Lugtu. I am an adult cardiologist as well as a cardiac electrophysiologist, and I'm here to answer the internet's most searched heart questions. Does heartbreak cause heart problems? Yes, because it did break my heart. Aww. But not directly, although eventually it would affect your well-being as well as your heart. Okay? Does heartbreak cause death? Not directly, but it may be indirectly. Again, if you're too much depressed or stressed, it will affect your heart. And then probably if you have previous heart disease na, there's already a heart disease and then you're depressed, that will lead you to die. So, but not directly. Okay, and does your heartbreak make you sick? Yes, literally it will. Okay, physically, mentally, yeah, it will make you sick. What are the symptoms of heart disease? Well, the most common symptoms, of course, chest pain, chest discomfort, difficulty of breathing. Some people would have a syncope or they would just lose consciousness because of a heart problem. So yeah, so those are the typical symptoms. Palpitations as well, very common, especially for the young. They always have these heat beats. Can you give a list of heart diseases? Dami to. Okay. 1, coronary artery disease, leading to ischemic heart disease, complete heart block, sick sinus syndrome, congenital heart diseases. Yeah, those are the basic yung mga groups of diseases.
Among the list of diseases you just mentioned, which is the most common in the Philippines?
Ischemic heart disease, the one that is causing heart attack. That's the most common. And it's also the #1 cause of death, not just in the Philippines, but also around the world. Okay, does ischemic heart disease cause hypertension? No. Ischemic heart disease will not directly cause hypertension. These two might interact with each other and would hypertension would cause ischemic heart disease. Right?
Doc, just for context, what is ischemic heart disease? Should we be worried about it?
Yes. So ischemic heart disease is when the heart is not receiving enough blood supply. So especially if the heart, if there is blockage of your arteries and the heart does not receive enough blood supply. So yeah, you should be worried because eventually it might cause you a heart attack. Is ischemic heart disease hereditary? There are some cases in which you can inherit the disease, but most of the time, IHD or ischemic heart disease is acquired. Can ischemic heart disease be cured? Yes, it can be cured, especially if you're symptomatic. You may undergo special procedures like angiogram, angioplasty to cure the ischemic heart disease. How is coronary artery disease diagnosed? Well, to diagnose coronary artery disease, you have to undergo angiogram para makita yung mga coronaries. But there are some methods in which you would be able to diagnose them without doing invasive procedures, like non-invasive procedures like stress test or nuclear scan or cardiac MRI with stress test. How does coronary artery disease affect the respiratory system? Daming tanong. Okay. Well, of course, the heart and lungs, partner yan. So, syempre, kapag may problem sa heart, eventually maapektuhan yung lungs. Kaya, kaya nga sila magkatabi eh. Kaya they affect each other. Pero hindi ibig sabihin cardiologists and pulmonologists ang partner. Okay. What causes congenital heart disease in babies? Usually during pregnancy, for example, if the mother is exposed to some toxins or viruses, okay. But of course, not congenital heart disease. Not all congenital heart disease are affected by external factors. Sometimes it's nandun na talaga during formation of the baby. Okay. And can congenital heart disease be detected before birth? Yes, it can be detected before birth. So that's why for those who are pregnant at 26 weeks, well, mothers are advised to have ultrasound to detect congenital anomalies. Can congenital heart disease be prevented? No, it cannot be prevented. There's no 100% guarantee that your baby will not have congenital heart disease. So, yeah, even if you avoid yourself having all those toxins like smoking or alcohol drinking, unfortunately, it cannot be 100% prevented. Can congenital heart disease be cured? No, there's no cure for congenital heart disease. It's not like a simple infection or pneumonia that you will just give antibiotics and then it will be cured. So for patients who have congenital heart disease, basically what the surgeons do is to correct the problem or repair it. That's it. I'm Dr. Lugtu, cardiologist, and I hope you enjoyed our little heart-to-heart chat. Coming here from the Medical City Clark, your partner in health. Later, alligator.